This is part one of NG tube insertion. So step one is always verifying your order, and it'll typically have the indication. Now, NG tubes can be placed for two different reasons. It can either be decompression of the stomach, meaning we're pulling out the gastric secretions, or it can be used for feeding. So determine why you're putting in the tube before you begin, because that'll impact the size of the tube that's needed. Typically for decompression, you need a little bit of a larger French NG tube, and for a long-term feeding tube, because it irritates the mucosa in the nose, you would want a small bore or a smaller size. So our patient has continuous vomiting, nausea, and they're ruling out a small bowel obstruction. So our physicians ordered an NG tube for decompression. So before I go into the room to begin explaining and assessing the patient, I want to go ahead and start by gathering all my supplies. If it's not contraindicated, you can bring some water that the patient could swallow with the tube going down. And as soon as the tube is inserted and hooked to suction, that water will be suctioned back out. So if it's not contraindicated, go ahead and bring some water. Check with your orders. If they're strict NPO, you will not be able to do that part. I've got pH paper that I'll be using to check the gastric secretions to ensure that the tube is in the stomach and not in the lungs. I've got tape with me that I'm going to be using to anchor my device. Hand sanitizer and gloves should be in the room for checkoffs. Just bring it with to be sure. We'll have hand sanitizer at each station. I'm going to want an irrigation tray that looks like this, that includes a piston syringe. It's nice because it tells you how much fluid is in there. So if you're documenting I&Os, you have that. I'll have a sterile water that I'll date, time, and initial. This is good for 24 hours. Some facilities will require you to use sterile water. Other facilities will be okay with you using just tap water. Just think, this is a clean, not a sterile procedure when we're dealing with the gut. I like to bring in a pen or a marker so that I can mark the spot on the tube if it doesn't have numbers so that you know how far to push it in. And I have my lubricating jelly, and that will it'll help with the ease of the tube passing down through the nose. So these are all the supplies that you will need to bring with you into the room.